Schools are scrambling to make sure that they have safety protocols in place for students this fall.
Joining us now, Dr. Beth Van Opstel from Rush University Medical Center. Thanks for joining us. You're an associate professor of pediatrics and internal medicine, and you've had firsthand experience with children during the pandemic. You're also a mom of 3, right?
That is correct, yes.
Well, doctor, tell us about this Lambda variant. We're hearing that there have been at least 1,000 cases, and it may be vaccine resistant.
Yeah, so as you're hearing in the news, we are concerned about multiple variants. Unfortunately, there are many people who yet are not vaccinated, and that does create an environment where it is easier for variants to exist and to spread.
For children who, are below the age of 12, cannot get any of the COVID vaccinations, what do you fear are the long-term risks that they face if they were to get infected?
Yeah, so, I have an interesting perspective in that I, as a both internal medicine and pediatrician, have seen COVID from various age spectrums. On the adult side, obviously, we do see many, many adults who unfortunately are very sick, and I've personally treated adults who haven't made it with COVID. Thankfully, for the most part, by and large, on the pediatric side, kids aren't being hospitalized as often proportionally as we see adults. However, we do see children who are hospitalized, especially if they have other high-risk conditions. And we are seeing children who have this post-inflammatory syndrome, which we call MIS-C, who, after having COVID, even sometimes months after, can have very serious illnesses.
Knowing what you know, how afraid are you for your children to go back to school this year? And also, as well as that, when do you think the vaccine will be available for children under 12 years old?
Yeah, I think choosing whether or not to send your kids back to school is a risk-benefit question that you have to think about for yourself, but also for society in general. And we know that there are lots of great benefits to being in school in person. My own children did struggle last year a lot with remote learning and with their mental health. And so it's a risk balance of kind of weighing what's better. The American Academy of Pediatrics do recommend that in general, kids are back in school 5 days a week when possible. And so for my own kids, we did opt to send them back in the spring. And I don't think I was regularly super fearful that they were going to get acutely very ill with COVID. But, we took common precautions and masked and things like that.
With so much... I'm sorry, finish your thought.
Oh, I was just going to say, as far as access to the vaccine, as a mom, it feels like not soon enough. But what I'm hearing is that it could be as early as late fall and possibly into next year.
I was going to ask, with so much attention being put on this mandatory vaccine question and the challenges that have come up, how do you liken the equation there? Kids today, when they go to school, they have to get vaccinations and they have to show proof of that, or they don't get to go to class. Do you see any difference between those vaccines and the COVID vaccine?
I think people are fearful because it's a newer vaccine, but in my mind, I see it in a very similar way. I am excited for my kids to get vaccinated. Once that vaccine is available, I will be the first in line if possible. And I think it's just a way not only to protect your children, but to think about your community, your school community, and their larger community, and to protect others in the household too.
Dr. Beth Van Opstel, thank you so much. Be safe, be well.
Thank you for having me.
Take care.